Down a bit.
It's going up quickly.
I'm sure there's lots of interest tonight. And thank you all for quickly being able to join us this evening. And we are recording this session, so if folks are not able to join us tonight, we will be sending out an email with the recording tonight. It'll take us a little time to download and upload the video and share it, but we will get that email out tonight, and we will also share the presentation that we have as well on the website that went live. So we are going to start in just a moment or two.
Numbers have settled, Megan.
Okay, great. I want to remind everybody that there is a question and answer button below on your Zoom bar, for lack of a better word, where you can ask questions, and I will live, and Jolene and I will live answer those questions. But let me just start with some introductions here. For those of you who don't know me, my name is Megan Costello. I'm the senior advisor to the superintendent, and really thrilled to be able to be working on this project with my partner in crime, Jolene John. So Jolene, I'll allow you to introduce yourself as well.
Good evening, everyone. I'm Jerlene John, former headmaster, and happy to be working on this project with Megan as well.
Great. So everybody probably has heard a lot of news today about vaccines for K-12 workers. So we wanted to share the information that we know. And we also wanted to share that this information is ever changing and ever evolving, but our commitment to you is that we will continue to stay in touch with the latest information that we know. So you may see a lot of email communication or text communication, and we're trying to get that information out to you as soon as we have it. So we wanted to pull everybody together tonight, knowing that some folks might not be able to make it because it's a little bit last minute, but we wanted to pull you together tonight to share what we know so far. So here's the facts of what we know. Yesterday, President Biden announced the prioritization of K-12 workers and asked states to do the same thing. And today, Governor Baker announced the eligibility of K-12 workers with sign-ups beginning March 11th. I want to be clear on that piece. People cannot start signing up until March 11th. So it's not that we're going to start getting vaccines on March 11th, it's that you can sign up on March 11th. And then the third piece that folks have heard about today is that CVS Pharmacy has announced they are scheduling slots for K-12 workers now. The reason that in Massachusetts, CVS Pharmacy is doing this now is because they are following the federal guidance from President Biden, who has prioritized K-12 workers now, whereas the other clinics in the state are following the governor's guidance and making those slots available for signups beginning March 11th. So I just wanted to clarify that because there is some confusion around, well, why has CVS started booking, allowing for slots to happen? And so that is the reason why CVS is getting their slots from the federal government. And so they are following the federal guidance. We do anticipate, CVS seems to be booked right now, right? I think everybody in the world, once they heard that, not the world, when Massachusetts heard that, they went to sign up, and those slots are currently taken. We do know that they're going to add a very limited number of available slots tomorrow morning, early around 6 a.m. So we do want to encourage folks. We know not everybody will be able to get one of those slots. I think those slots are going to go very quickly, but we wanted to be as transparent as possible with that information because we do want you to know that that is an option for you to sign up. Even though the governor has said K-12 workers sign up March 11th, CVS is the one exception to that. So the overall good news here is that vaccines are coming. And while this information is ever changing and, it's creating a lot of anxiety in some ways because people are searching quickly for information, this is good news. And we want to just pause and reflect on that because this has been a long time coming. Want to share with you specifically what we know about the Boston Public School clinics that we have talked to you about and the vaccine availability from the state. So these clinics, as we have said in other info sessions and in communication from BPS through email and text message, These clinics are dependent on vaccines from the state. We cannot, even if we had, billions of dollars, we cannot get those vaccines unless the state gives them to us. It's something that we have to put a request in. And right now, basic economics, we are seeing more demand than supply. And so the state does not currently have vaccines and in this moment for our clinics. We are continuing to work with the Boston Public Health Commission. We are continuing to work with our partners at the state to understand when more supply will be available, but it's not within BPS's control to get more vaccines in this moment. So I just want to pause and reflect there, right? This is hard because we want these clinics to be operating right away, but we have to face reality and just know that the state does not have the supply immediately. We believe we will eventually get there, but in this moment, we will not have them as operational. And we do not have a date yet for when BPS clinics will begin to be operational. This is a very much a one day at a time situation, and we will continue to push both Boston Public Health Commission and the state to get these vaccines for the clinics. So how can you get a vaccine once K-12 workers are eligible? A few different ways. You may remember that we have outlined 4 different ways for our workforce to receive vaccines. The first being anybody can sign up through the state's mass vaccination clinics. You can go to the state website and do that. The second is community-based clinics. So these are your local health centers or maybe community-based organizations such as churches and other local pharmacies, right? So those you can sign up for beginning March 11th. The third way is priority slots with existing clinical partners. We do expect that we will get some priority slots. And in fact, we have received some priority slots from the Boston Public Health Commission for anybody who qualifies now. So that's phase 2, step 2. So that's the 65 and older, that's the 2 or more comorbidities, or it's a specific job category related to behavioral health, school safety officers, ABAs, OTs, PTs, school nurses, et cetera. So if you qualify for one of those conditions, right, or areas, you can right now sign up for a priority slot. If you go to vaccine.bostonpublicschools.org. We have a very limited number of slots. There's about 400 slots. We really need you to make sure, and you will be asked by the state to fill out a form that you currently qualify as having 2 or more comorbidities, 65 and plus, what are and then the other worker categories, right? But if you are K-12 worker and that's how you qualify, you are not yet eligible until March 11th, right? So we do want to just point that out. And we expect that we will continue through our partnership with the Boston Public Health Commission to get priority slots from existing clinics. And so how that is going to work, it's a little bit hard to predict, right? The Boston Public Health Commission is going to call us and say, in 2 days or next week, there's 300 slots from Tufts or Reggie or one of the clinics that's currently operating. We will send out an email with that information. We will try to be aware of the time that we send that as best as possible. I'd like to send it after school hours, but this is quickly evolving, and so we might have to be flexible with that a little bit. And what you'll do there is you will fill out a Google form with your name, your date of birth, and verifying that you are, a BPS employee and your cell phone number. You will then get a phone call from the clinical partner where these slots exist, and they will schedule an appointment for you. The fourth option that is not yet available to us is these 2 BPS clinics that we are hoping to lift up soon. Again, I just want to emphasize, we would lift these up tomorrow if we could, but we don't have the vaccines from the state. So this is how you can get vaccinated, start signing up starting on March 11th. If you do fit the categories right now and you happen to be, a K-12 worker, you can sign up using the priority slots from Tufts. So just want to set some expectations. Again, like I said before, the good news is vaccines are coming. And I think, we've seen this a lot through this pandemic. When there is new information or new eligibility or new PEE or, whatever the thing is, there's a limited supply at the beginning. And it takes some time to work out these kinks. But we're going to get there. And we are committed to making sure that our employees, if they want a vaccine, get a vaccine. And so we're asking for everybody's patience as we navigate this together. And like I said, we will eventually get there. And we know there are going to be frustrations. We know there are already frustrations with, okay, CVS is saying, they're going to vaccinate teachers, but there's no slots. Or the state website, I can't sign up for 2 days because that's where I am in line. We know there are frustrations, and we unfortunately are not in control of those pieces. And that's why we're trying so hard to lift up these clinics for our own folks, but we're just not quite there yet. So that is the information that we have so far. I want to remind folks that if you have specific questions or concerns outside of this info session, or if we need, if we can't answer it here and you want to follow up, you can email us at vaccine@bostonpublicschools.org. That is the quickest way to get a response. And there's many of us, including myself and Jerlene, who are on those emails. Or you can also call the vaccine info hotline. So with that, I'm going to stop sharing my screen, and I am going to open up the question and answers. Jerlene, is there anything you wanted to add?
No, I was going to get to the questions.
That would be great.
Okay, so the first question, Megan, is about time off. Do we get time off to get our shots, or do we have to use our own time?
I think I have an answer for that in my inbox. So let me loop back to that one.
Okay.
Because I do want to the most accurate information.
And for the priority spots, is there any preference given to employees currently working in person?
So for the priority slots, it's not just the category of K-12 workers. It's anybody who's 65 and older, 2 or more comorbidities, and some of those worker classes that are currently eligible. So we have to offer it to those groups, right? We can't just say based on in person or not. So that those priority slots for this one time, or maybe more depending on if we get more before K-12 workers are eligible, is open to all folks.
Okay, great. Are we allowed to sign up for a vaccine that is dated past the 11th through the state as of now, or should we wait until the 11th to sign up?
Yeah, that's a great question. So folks have tried to go onto the website and sign up for appointments that are later, but when you go to sign up, you actually get asked a bunch of different questions to determine your eligibility, and you will not be able to sign up because K-12 workers cannot start signing up until the 11th. So you can keep trying if you want. That's your personal decision to make, but the guidance we have been given is that you will not be able to sign up until March 11th.
Okay, good. Could you clarify if all BPS, hold on, give me a second. Oops, hold on. Could you clarify if all BPS employees, regardless of whether you are school or central office based, are eligible for the CVS slots that are open right now?
Yes. Anybody who is a K-12 worker in Massachusetts can sign up for a CVS slot if they can get one, regardless of school-based or central. That is, CVS determines, that piece, and so they have opened it up to all K-12 workers.
Okay. Are sub-separate teachers and paras who are responsible for providing the ABA and specialty services eligible for the vaccine currently?
So if I'm understanding this correctly, this is a question about if people who work with ABAs are also eligible.
Are eligible right now for those slots that are available right now.
So we have to go by the state guidance. So that is a really great question, because those are also folks who are, with those students. So I don't quite know how to answer that, because I know we have to legally follow the state guidelines. I do know that, when you sign up, they will call you and ask you questions to confirm your eligibility. And so one of the healthcare providers might be able to answer that question better than I can. But my commitment to you on this is to learn more information and put this on the website, because we're going to have frequently asked questions there. And this is a question that we can get an answer to, and I just don't want to give out wrong information now.
Okay. Why don't the nurses at our schools give us the vaccinations?
That's a great question.
Why don't we put in a request in for when they do become available?
Sure. So our nurses, as we all know, are doing so many different things right now. And I know that they would want to do this, I think, if they could, right? But unfortunately, given their job responsibilities, and also given the fact that we can't bring vaccines to schools because they require refrigeration. There's all kinds of regulations about a pharmacist having to be on site. So it's not as simply as us bringing, a box of vaccines over to a school and saying, okay, nurses, you can give this out. There's a lot that goes into it. And it's required that it happen at one of these clinics that's approved by the state.
Okay. What vaccine will be available at BPS clinics, Pfizer or Moderna? Not sure if you have an answer to that yet.
Yeah, so that's something we don't have an answer to yet. The way it works is that we get different vaccines every single week, right? And so that determines, depending on what the state gets, determines what the state gives. So we will have that information on our website when we can, when we know, when those clinics will be available. But unfortunately, we don't know right now. And I think,
Okay. Ali's gonna answer the time off question.
oh, awesome. Al, thank you so much.
No worries. The city has revised the policy, and teachers and paras will have that hour. They can utilize that hour to be vaccinated.
Awesome. Great news, Al. Thank you so much. So just to repeat that, there is an hour of paid time off that teachers and paras and custodians and any workers can use to receive that vaccine. Thank you, Al, for that important update.
And there's a specific memo that addresses how you go about using it, and I believe they've sent it to all employees today.
Oh, beautiful. And we can also put that on the website as well, Al, if that's okay. Great. We'll include that. Thank you.
Mm-hmm.
Welcome to stay, Al. All right.
Okay. A lot of questions here. Some questions about the vaccine specifically, and we don't have our medical team tonight. I'm not sure.
Yeah, if there's vaccine specific questions that are more medical, I would refer folks to either their physician or, potentially we can capture some of these questions here and talk with our partners at the Boston Public Health Commission. I'm just not a qualified expert to be answering those types of questions. And I apologize that this was very last minute that we pulled this together. So we don't have a medical expert on this call.
For priority slots, will there be a way to prioritize staff who see more than one cohort in person, sometimes even the whole school? I am a specialist who visits every classroom in the building and is exposed to all students.
So unfortunately, the only place where we have any control over prioritization of our employees is the BPS clinics. The state clinics, the community clinics, and the slots at existing clinics, we don't have the authority to say who can and cannot get vaccinated. We have to follow the state guidelines. And so we have to send it out, to all folks. So that that's why we put on the website the Tufts Medical Center slots, because we're trusting our workforce. They're going to know if they're 65 or older. They're going to know if they have 2 or more comorbidities. They're going to know if they're, an OT or a PT or an ABA. And we unfortunately, can't dictate to them how they give out those slots.
I just signed up for a vaccine on Monday, 3/8 through Tufts Medical Center. They confirmed my appointment. Will they turn me away if I go?
So I would recommend that you call Tufts and ask them that question. I think you're getting at the point that you are a K-12 worker, but they might have verified you for some other reason as qualifying. So I would work with Tufts to understand because I can't speak for them.
Another question about the vaccine. Which vaccine is going to be offered? Is the only vaccine available to K-12 workers as of now the Johnson & Johnson vaccine?
So unfortunately, we don't have this information because it just depends on what the federal government gives the state and what the state gives us. We will have this information on our website for the clinics that are available to our employees. I do want to just remind folks that, I think it was the last info session that Dr. Sanchez was asked a question of, do you have a preference of a vaccine? And she said, I would get any single one of them. And so this is a personal decision, something you have to make for yourself. We don't know yet what vaccines will be available to us, and it's likely that there will be kind of different combinations of vaccines available depending on what we get. But I would really encourage folks to get a vaccine when they can get a vaccine.
Another question about people working in ABA-based classrooms and whether they can sign up right now.
Yeah, that's a great question. And I need to get clarification on that. I will talk to folks tonight, and my commitment is to get that up on the website within the next 24 hours.
Okay. Oops. Ooh. I don't want to, okay. This is a supply and demand question here.
I'm not an economist.
I know, right? According to the Massachusetts website, there's not a single vaccination appointment slot available anywhere in the state, not even for those already qualified.
Yeah.
Do you have hard numbers from the state about the number of people already qualified, but not yet with appointments? So this will give us some idea of how long the wait might be.
Yeah, I don't have that information. What I do know is that the state updates their appointment slots. I believe it's every Thursday, and they're updating with what they get, right? And we know, just as it was with PPE, just as it was with testing in the beginning, any sort of new part of this pandemic, right? The beginning is hard because there's limited supply, and so I don't have hard numbers for you. I think the governor in his press conference today said he expects it to take about another month for folks using just the state clinics to sign up, right, to get appointments. But it's really hard to predict.
I have heard people with accommodations through Office of Equity have first preference for priority slots. Is this accurate?
I'm not sure I understand that question.
Can you repeat that question?
I heard people with accommodations through Office of Equity have first preference for priority slots. Is this accurate? So they heard from the Office of Equity that people with accommodations.
Yeah, I can't speak for the Office of Equity. I know that some folks have received the link, but I can't speak for the Office of Equity or for folks who are out on medical leave or disability.
The governor mentioned possible designated weekends at sites such as Gillette. Has that been made formal?
So yeah, that is something that Chief Martinez informed me about could potentially happen, is that Governor Baker would dedicate, specific days for different workers. So there would be like a K-12 worker day or multiple days, right? We don't yet have information about when and where those places will be, but as soon as we do, you will absolutely have that information.
Al, another question for you. A question about whether an hour is enough time.
So our clinical, I can help you out here a little bit, Al. Our clinical partner said that, expect the whole process to take about an hour. And I think one of the reasons we wanted to have our clinics was because we were going to do afternoon times, right, outside of school, and also a weekend day. We know this is going to be a little bit challenging, having to rely on the state appointments and clinical partners that are currently operating, because I can't speak to when their hours of operations will be. But I do know that, the BPS employees are very resilient, very resourceful, and we will figure this out. We want people to get the slots. But yeah, so Al, I don't know if you have anything you want to add to that.
No, and we have asked school leaders to try to be as cooperative as possible and to work with folks, and try to be as flexible as they possibly can be, as long as it doesn't, negatively impact being able to deliver services to children.
Okay.
And a lot of our school leaders definitely are going to try to work with their staff to ensure that everybody gets vaccinated.
Okay, great. Thank you. Can we get vaccinated in another state if slots are available through CVS?
Great question. I don't know. I don't know what other state guidance.
It contingent upon, I know in Massachusetts, in order to be vaccinated here, they require you to be a Massachusetts resident. I don't know if the other states have those same requirements.
Okay. What happens if you become sick after taking the vaccination? Will there be paid time off?
It would be like any other vaccination situation. You'd have to use your own, your normal sick pay time off.
Many of our students' parents are home child care providers. They have asked if they're included in this category of eligible groups for the vaccine.
My understanding is that they are.
Yes.
They're considered K-12, K0, kindergarten, they're considered K-12 educated, so.
Yeah. Short answer, yes.
About a question about prioritization. How will the BPS sites be prioritized?
Yeah, so we're still working on those groupings. The information is ever changing, and some folks that are more vulnerable, right? The 65 plus, right, are currently eligible. So we're working. We need to see how many of those folks we can get vaccinated to help determine the prioritization. I do want to just say, we've heard folks loud and clear on the school-based folks, the folks that are currently in person, with our young ones, and older ones. So we will update you as soon as we have that information. But because things are moving so quickly and changing, we don't have that right now.
Okay. What is BPS doing about getting coverage for us, since there are no subs taking the jobs? We don't even have coverage for regular subs.
So we have reached out to all of the colleges. We're trying to onboard seniors that are in education programs to see if they want to substitute teach. We've been successful in some of those situations, but not in many. Unfortunately, a lot of our substitute teachers are not taking assignments because they feel like it'll upset their unemployment, and then others are just waiting to be vaccinated before they make a decision whether or not to come back. So we're aware of the difficulties. We're working aggressively to try to support and help schools, but as you can imagine, it's been very, very challenging.
Mm-hmm.
Thanks, Al.
Mm-hmm.
I do just want to clarify one thing, because I think some people have joined us a little bit late here. So some folks might hear me talking about the Tufts Medical Center slots that are available for our workforce that currently qualifies. So these are 65 and older. These are 2 or more comorbidities. These are folks who meet some sort of worker criteria. So school nurse, school safety officer, OTs, PTs, ABAs. This is the state's guidelines. and we have to go by what they say. K-12 workers are not yet eligible. They will be eligible to begin signing up for appointments beginning March 11th. So there are a very limited number of slots on the website right now for Tufts Medical Center, but we ask folks to use the honor system, right? And also Tufts Medical Center is going to call you and verify, they're going to ask you questions to make sure that you do qualify right now. So I just wanted to clarify that piece because I think some people had further questions about that.
There are a couple more questions about the time off, Al. You might want to repeat that because some people joined late. So if you have side effects from the vaccine, especially after the second dose, do we use sick time if we need to recover?
Yeah, you have to use your own sick time. It's just like any other medical situation where you get vaccinated. Like if you're getting vaccinated for chickenpox or the measles or something of that nature, you would have to use your own sick time.
So folks are asking about the website as well. Mark, I don't know if there's a way to share it here, and it might be helpful to give a visual if folks want to see it. The website is vaccine.bostonpublicschools.org. I'll repeat that one more time. Vaccine.bostonpublicschools.org. Mark, do we want to show folks what that looks like?
Yeah, I'm just going to jump in here. And while you're doing that, I also want to do some further clarification on the Tufts location. So if you are to go to the Tufts Medical Center's website right now and click on the vaccine site, you're not going to find any appointments. What Megan was referring to about the Tufts location, we have dedicated spots for BPS employees that are given to us outside of their normal website. The only way to request a spot, one of those 400 spots, first off, you have to be in the first two groups, over 65, a medical professional, safety, emergency safety individual, or two or more comorbidities. The only way for BPS employees to be eligible for one of these spots is to click this request appointment on the vaccine.bostonpublicschools.org website. You will not find the Tufts appointments on the Tufts Medical Center's general website because we've taken those offline and those are only available to BPS employees. You go to the website and you click appointment, you'll be asked to sign in through your Boston Public Schools email address, and that's how we ensure that those those appointments that we've allocated or we've received for BPS employees are dedicated to BPS employees. Those sites are not prioritized. They're not open for K-12 employees. It's just for phase 1 and phase 2. As we open up the other sites, as we get more and more, as we get the vaccine available, then we'll be able to add sites onto these two locations as well. These are the two dedicated BPS spots. And as soon as Boston Public Schools is allocated the vaccine, we'll be able to open up that schedule button and make that available to us. Down below, we have the mass vaccination sites. Again, these are only available right now under phase 1 and phase 2, with the exception of CVS Pharmacy. If you click this button, you'll be taken to CVS, their website. We do not have any control over CVS's appointments, but we have been told that they're going to be posted at 6 a.m. And so you can click that button or just go right to CVS's website. And then down below are the other sites, and then you get into the community clinics as well. So vaccine.bostonpublicschools.org, we've posted questions from the other sessions. We've also posted the info sessions in which we did have the Boston Public Health Commission. You can watch the video, you can view their PowerPoint, and some of the questions that were asked in tonight's chat that we're not able to answer due to medical reasons may have already been answered by the Boston Public Health Commission in those webinars. And then tonight's recording will also be posted there.
Thanks, Mark. And do you mind showing people also like when they go to vaccine.bostonpublicschools.org, just what that homepage looks like? Because I want folks to see where they have to sign in. Is that
Sure. Yep.
I'm a visual
This is-
learner. You can't see Mark.
Yeah, so this is the homepage. The overview page is where we have the videos and the PowerPoints from the last info sessions, and we'll have tonight's on there as well. The questions and answers, we're trying to keep track of the most commonly asked questions and answers. And then the book appointment page is where you'll sign in with Google. If you do receive an error, just make sure that you're signed in with your Boston Public Schools Gmail account. If you try to sign in with a personal account, it will not let you in. This is why we're trying to lock those sites available for just BPS staff so the general public does not take our spots.
Thanks for that clarification, Mark. I think it's just important because we have received some questions from people emailing from their personal accounts about why they can't access that. So you must be logged in. Access that page using your BPS email address. All right, let's go back to these questions. So the question around the proof of your comorbidities, there is no proof needed. Tufts Medical Center will call you and they'll ask you questions to verify that you qualify. But it's the honor system, and we ask that people, be honest. Does a pharmacy tech qualify as a medical professional? I don't know the answer to that question. I would refer you to the state. The state has laid out some very specific guidance for different categories of workforces that qualify. So I would refer you to the state website for that information. A question about continued testing for staff. I unfortunately am not qualified to answer that question either. But I do think we can probably put a question on the website about that. Teachers with pre-existing health conditions. So the current qualifications, the question is, teachers with pre-existing health conditions, do they have priority? So right now, the qualifications are if you are 65 and older, if you have 2 or more health conditions, and there's a very specific list of what those are on the state website, or if you are currently a worker in a specific category. So I would advise you to look at the state website to understand if your health conditions qualify you to receive a vaccine now.
There's some prioritization questions, Megan, about once we begin, what is going to be the prioritization for BPS employees?
So as I said, we can only prioritize at the BPS clinics. And because we don't really know when those are going to begin being operational, and we need to sort of assess, who in our workforce is getting vaccines, how they're getting vaccines. It's an ever evolving piece. So we don't have those groupings yet. I can tell you that we're anticipating once we can get these clinics up and running, which I am hopeful about, it's just not happening as soon as we thought. We will be able to vaccinate 5,000 people with both doses if they're getting a vaccine that requires 2 doses. So I am hopeful that we'll be able to vaccinate a good chunk of folks. The other piece is, the superintendent is very committed to supporting our employees getting vaccines, and she's really done a lot to try to prepare for this. But a lot of it's out of our control, right? And so we will continue, this is one day at a time, and we will continue to monitor the need and the demand, and see if we need to potentially extend these clinics, if that's a possibility, right? So we're in this phase right now where we're excited that K-12 workers are soon to be eligible, but we have this challenge of limited availability of supply. And so our commitment is to continue to do all that we can to advocate for, as many vaccines as we can get, and to advocate that we eventually lift up our own clinics, and to advocate that, those who need a vaccine and want a vaccine can get one.
And I'll just real quick around clarity around the paid time off. So for testing, it's 1 hour every 14 days. And for vaccination, it's twice within a 40-day period. So you have 1 hour for the first dose, and within another 40 days, another 1 hour for the second dose.
Great. Thank you, Al.
Megan, I received a question privately that I thought I would answer as a group. The Tufts medical form on the website. So vaccine.bostonschools.org. There's a private form just for BPS employees if you fall into phase 1 or phase 2. You do not have to share any additional information. You do not have to share any reason why you were signing up. You do not have to share anything around any sort of medical conditions. That information is going straight to Tufts Medical Center. And the next contact you'll hear is from a health professional at Tufts Medical Center scheduling your appointment. Nobody at BPS is filtering that information. Nobody at BPS is reviewing that information for accuracy. And that is entirely up to you in terms of what you decide to share with the medical professionals.
Yeah, thanks for that, Mark. It's super important. The Google form asks for very simple information. You will see that at the top of the Google form, and this was just sent, so we'll have to get this out to folks that might have already signed up, but there is a link to the Massachusetts website where they ask you to verify some stuff, but we don't receive that information. We receive none of it. So it's very simple. I think it's like 5 questions that we ask just to get the names and phone numbers, to Tufts. And then you'll get a call from there. So answer your phone. If you don't normally pick up numbers that you don't know, you might want to if you're filling out that form. And it's just looking at, I know there's a lot more questions, trying to get through them all. I'm sorry if we're missing some because I'm scrolling. So if you get vaccinated for the 2 BPS sites, how will appointments be handled? So my understanding, and we're working with our clinical partner because again, this is changing, is that you will be able to go onto the vaccines.bostonpublicschools.org website, and you'll be able to click schedule, right? And it will take you to a website that we don't manage, but it's where the slot, where the appointments can be made. So again, that's not information that we get, right? That's our clinical partners page where they receive that information. Then if you do require a second shot because you're getting either the Pfizer or Moderna vaccine, they will schedule the appointment for you right then and there.
Megan, I see a question about that asks, I don't know if we answered it, but it asks if guidance counselors are eligible, but the answer is yes. So just
Great, thanks, Al. Appreciate that. Yeah, can we put the hotline up? I don't know if there's a way to, oh, there's a type answer, sorry. A little bit. Yeah.
There's a question in the chat about a person that lives out of state, but because they work in BPS, they still would be eligible. So yeah. Yes, if you're a BPS employee, you would be eligible.
Yeah, you're a K-12 worker in Massachusetts.
Correct.
Yep. I've heard that the Reggie Lewis Center is giving up walk-up vaccines. Has anyone tried this and did it work? I have not heard that. I strongly recommend that folks make appointments.
Yeah, you have to make an appointment.
Yeah. Sometimes
it works when they have extras and feel like they're gonna, it will go to waste. And then other times they have enough appointments where they, so I would take Megan's recommendation and make an appointment.
Yeah, don't want to waste your time going over there if you can't get it. So,
do you need to bring proof of your pre-existing condition to your appointment?
No, it's the honor system here, so no proof needed. And then there's a question of, is there a known way we will be asked to show that we are K-12 eligible? My understanding is that's also the honor system. And you will be asked for a photo ID to verify who you are, but there's no, at the state and other places, there's no verification needed about your K-12 status. At the BPS clinics, if and when we can operate those, which I am hopeful about, I want to say, we will be verifying that you're a BPS employee by asking you either for your employee ID or for your last name so that we can look you up in our database just to verify that you are a BPS employee. But you won't have to show your ID or anything like that.
Okay. If we get the initial vaccine at an outside clinic, can we get the second shot at the BPS clinic provided that it is the same vaccine?
Yes. So if there's if once the BPS clinics can begin operations, which again I'm hopeful about, but we don't have date. You will the same location where you get your first shot. If you are getting a vaccine that requires 2 shots, you will get it at the same location. So that clinic will continue to operate. The way it's ideally going to work is we do 2 weeks of first shot, take that 21-day break, 2 weeks of second shot, and then evaluate if we need more weeks because there's just more demand.
Okay. Trying to answer as many as you can here. Hold on.
So there's a question about, are there specific time slots that will be released through different sites once things go live on 3/11? I don't have an answer to that question, right? It's very, unfortunately, it's very reactionary. And we sort of get bits of information and have to quickly kind of put that out there. Our commitment to you is that when we do update the website, we will send out notification, right, that more slots have been allotted. And I want people to be thoughtful about when they need a vaccine, right, and helping other people who might not be as tech savvy or who might not be on their email all the time. Like we should support each other, right, in trying to get these vaccines. And I am hopeful that as time goes by here, we will be able to open up those clinics, which will open up a tremendous amount of slots for us between the 2 clinics. So we're hopeful that we're able to do 500 people a day. And that would really, make things go a lot faster for our workforce. But again, the state does not have the vaccines to give us that right now. But we continue to advocate for that piece. So there's a question here about, can we choose which vaccine we want? I think we touched on this a little bit, but the challenge is we don't know, right? Especially for the priority slots, we don't really get a ton of information about that. So we recommend that, we will have information for the BPS clinics about which shots are available. But I want to remind folks that Dr. Sanchez from the Boston Public Health Commission said last week that, she doesn't have a preference for shot, right? She's a medical professional and she says they are all effective and safe, and she would take any shot that she could. So it's a personal decision, but we would encourage folks to do some research, and we have information about the vaccines on our website, and there's lots of other places in CDC and other places you can go, but we don't have control over which shot we're going to be getting. Sorry, skipping.
Last week, you said that there will be sites opening on the north side of Boston. Is that still going to happen now?
Yeah, so those were the priority slots, right? So we know that we put the clinics sort of on the south side, southern part of the city, and we knew that some of the priority slots were potentially, like Tufts Medical Center, which is in Chinatown, would be available. So it's ever evolving, right? There's going to be some weeks where Tufts is available to us. There's going to be some weeks where Reggie is available to us. There's going to be other weeks where there might be another clinical partner that we don't know about, right? So it will just, I ask for everyone's patience and grace here as we navigate this together, because we don't know what the future holds immediately, right? Like we can only really take this one day at a time and work with the information that we have in the moment. I see a question here about an allergy. So you should talk to your doctor to understand if you should receive the vaccine. What happens if you show up for the vaccine and decide not to get the shot? Obviously, that's your decision to make. but just please do know that, when you take a slot, that is an allocation of a vaccine that we have made. We do anticipate having people on a wait list, or, other people that, work nearby, maybe, that we can call. So we are going to, think about how we might be able to get, if there are extra doses at the end of a day, right? How we could potentially make sure those doses don't go to waste. But we do just ask you to be thoughtful about signing up for a slot. And if you do, for example, too, like if you get a state slot that's more convenient for you, but you've already signed up for a priority slot, please let us know, because we do need to really make sure that we're maximizing this as best we can. I do just want to be mindful of everybody's time, and we've got about 5 to 10 more minutes on this info session.
Question that was emailed to me directly around will medical professionals be on site at the vaccination sites? The answer to that is that the BPS sites that BPS is contracted with at the Gallivan BCYF Center and the BTU headquarters are provided by outside professionals. They're not BPS staff who are delivering the shot. So there will be medical professionals doing the intake, the actual vaccination, and then watching over staff for 15 minutes. So that will all be done by medical professionals. And as Megan had expressed earlier, that also explains some of the challenges with having to have dedicated sites for the vaccinations, which is why we can't do them within every school building.
Thanks, Mark. And a couple last questions I'm seeing here. What do we need so they know we work with BPS? We will ask for your either BPS ID or your last name or some way to verify you, and we'll look it up. But you don't need to bring your BPS ID or anything like that. And then there's a question: does every every BPS employee required to have a vaccine? The answer is no. We're not requiring vaccines. We do strongly encourage our workforce to get vaccinated.
Can you receive more than one vaccine? That might be something for the
that's a medical
Mhm.
professional question. I don't know the answer to that question. And I want to lift up Hannah's comment again about the ABA folks in classrooms. I hear you on that. I will do my darndest to get an answer right away for you.
How about BPS retirees?
We are currently vaccinating our current employees.
EPS employees that are retirees that are registered to be substitute teachers in the district and that sub are eligible.
Yep. Thank you, Al, for that clarification. All right. Yeah, so Melissa's asking a question about, she works in Central, she wants a vaccine, but doesn't need to get ahead of people who work in school buildings. Thank you, Melissa, for lifting that up. I think there's a lot of folks who feel that way. And that's why we don't have control over who can sign up for any of the state or community clinics or even these different clinical spots that we're getting. What we will have control over is the BPS sites. And so that's where we plan on doing some recommended groupings, right, based on who's in person, all kinds of different factors that the Human Capital Office and Office of Equity are taking into consideration. So our recommendation is, if you are K-12 worker starting March 11th, anybody, regardless of where you are, you can sign up, but it's your choice if you want to, be mindful of, I can continue to work from remote for a while and I'm going to save that for somebody else. So your choice. Is there a site that makes the extra vaccine? That would be other, I'm sorry, is there a site that makes the extra vaccine that would otherwise go to waste at the vaccine site at the end of a day available? So I think I'm understanding this question as sort of what if there are extra vaccines available? So from our clinical partners, what they've told us, and again, this, I don't know how it works in the state. I don't know how it works for the community clinics. or CVS or anything like that. But for our clinical partners have told us that they will know around 3 or 4 or 5 o'clock in the afternoon if they will have extra doses. And so then we would start calling sort of folks who are on a wait list if there is a wait list. So if, for example, say we start, vaccinating folks or operating the clinics April 1, right? If all of those slots for that week are taken up, that's when we would start a wait list and we would start calling through those folks to say, okay, there's extra doses, come get your vaccine if you want it, if you can. Okay. This might be an Al question too. Will teachers have the option of continuing remote until they are vaccinated?
Say that again. I'm sorry. I didn't hear that.
Will teachers have the option of continuing remote until they are vaccinated?
That's actually a question that you have to work out within your school through the work plan. So in some cases, if you have in-person children, you could be directed to come back into work. So it's technically something that you should work out with your school leader.
Great, thanks, Al.
And there's a similar one here to Al. I'm not sure if why is a BPS employee that reports to a school building being asked to return before at least receiving the first vaccine shot?
According to CDC and the Boston Health Commission, it's safe for teachers to come back to school. The infection rate is well under 4%. And as they've been reporting all along, although children can get COVID, not very many children get COVID.
Yeah.
So I feel like if you follow all the health guidelines, it's very, very safe to come back to school with all the various different protocols that school districts have put in place.
Yeah, a number of mitigating proactive safety measures, Al, that I've seen in our schools, having been in nearly about 20 of them in the last month. So thanks for that. And then I think I'm going to end with this last question here, just being mindful of everybody's time. Where can we make an appointment for the vaccine? So just to loop back on that one more time. So the website is vaccines.bostonpublicschools.org. This is a website that we have created for our workforce that is sort of all of the, not sort of, it is all of the information in one place. We've done this because we know the state website, the clinic website, all these different websites can be confusing, right? And Mark and his team have done a phenomenal job to sort of pull this all together. So on that website, you will see all these different options. If you would like to try to see if there's an availability of an appointment, you can click on schedule, right? But I want to remind folks that only those who qualify for phase 2, step 2, which is over 65, 2 or more comorbidities, or one of the sort of worker categories that qualify right now. Those are the only folks that can schedule an appointment now. K-12 workers, we can begin signing up for appointments on March 11th. So if you're a K-12 worker, you can begin to sign up for appointments on that website beginning March 11th. Will we be doing this again? I don't know. Jarlene, take this show on the road.
Absolutely. We'll do it as many times as necessary.
Yeah, absolutely. You know, we're deeply committed to sharing information as we get it. And we know that, you know, there's multiple ways to do that. We have been texting, we have been emailing, but this face-to-face stuff I think is helpful, right? And it gives people an opportunity to sort of come together and be excited about, you know, this time, right? We're hopeful about this vaccine, but also share the anxiety of what does this actually look like. And, you know, myself and Jarlene and Al and Mark and the superintendent, we're sort of building the plane as we fly it, right? But we want to be transparent with you about what we know so far and how committed we are to ensuring that our folks can receive a vaccine if they want it. So thank you to everybody on this call for all that you're doing. You know, we know this has been an incredibly long year. And this is the hope that we're holding on to. And as I said, one day at a time, and we will get there. So thank you all very much. And we will get this recording out to everybody as soon as we can later this evening. Have a good night.
Thank you. Good night.